Hello, my name is Brittany. I'm the founder of Necessary Doulas. So today I'm going to tell you a bit about this historical evolution of maternity care in Canada and talk to you about why having a necessary doula is a good idea. So about 50 years ago, when my grandma gave birth, in her first delivery, she was given ether, which put her to sleep. She delivered the baby while she was asleep, and then she woke up to a nurse sort of tapping her on her cheek saying, "Congratulations, you have a daughter." About 13 years later, when she had her last baby, she stayed awake during the delivery. She was given an epidural, and she delivered her baby while awake, and she says now that that is the most exciting day of her life. 30 years later, when my mother gave birth, she was followed during her prenatal care by her family doctor. That family doctor showed up to deliver the baby and then followed her during the postpartum period and integrated her into a family model of care. Now, in the Ottawa-Gatineau region, we have two different models of care working side by side. So we have the midwifery model of care, which brings women in during the prenatal period, follows them closely during their pregnancy. The midwife and her team, maybe one or two of them, show up to deliver the baby at the hospital or at home or at the new birth and wellness center. And the midwife follows the mom and her family closely during the first 6 weeks of the postpartum period. We also have the obstetrical model of care happening in Ottawa-Gatineau. So in that model, a woman is usually followed closely during the prenatal period by her obstetrician. Obstetricians tend to work in team models of care, which means that your doctor may work in a team practice with 10 or more other obstetricians. So when you go to the hospital to deliver your baby, one of 10 doctors will actually do the delivery. And this is an excellent model of care for high-risk women who really need this type of medical support. So I think this is perhaps a lack in the obstetrical model of care, that you don't know the provider that will be assisting at your delivery. So this is where doulas fit in. If you have a midwife, you can also have a doula and they'll do a great job. In the obstetrical model of care, you'll have a doula in the prenatal period who you get to know, talk about birth planning, talk about how things are going in the house, what you can expect during the delivery. Your doula will show up to assist at the delivery, which means providing continuity of care and emotional support. And then the doula will come to your house during the postpartum period to make sure things are going well and breastfeeding is getting established, these types of concerns that new moms and families may have. So when you choose Necessary Doulas, you'll meet two doulas, you'll have a prenatal appointment with both of them, and then one of them at all times will be on call to come to your labor and delivery, wherever you choose to deliver your baby. Then your doula will come to your house postpartum to ensure that things are going well. So we look forward to hearing from you. You can write to us at necessarydoulas@gmail.com, or you can follow us on Twitter and Facebook. Thank you.